Hello, my name is Cassidy and I'm going to be your student nurse today. Is it okay if I perform a respiratory assessment on you?
Sure.
Okay. So I'm going to perform hand hygiene and I'm going to clean off my stethoscope. Okay. So first I'm just going to inspect my patient's respiratory effort. He appears to be very relaxed and in no respiratory distress. He is not in any abnormal position such as tripoding, and he is not using an increased effort to breathe. So everything appears to be normal and he's in no respiratory distress. Have you had a cough recently?
No.
Do you have any respiratory issues I should be aware of?
No.
Okay. Next, I'm going to inspect my patient's nail beds. So can I see your hands? Okay, so I'm looking for any cyanosis or blue tinge to the fingernails that would indicate inadequate oxygenation. And I'm also looking for clubbing of the fingernails, which I don't see. Everything appears to be normal. Next, I'm going to ask my patient to turn around. Okay, first I am inspecting my patient's back. I'm looking for any trauma, which I don't see. I see a normal positioning of the thorax with it being symmetric on both sides. Next, I'm going to palpate my patient's back.
Hands are cold.
Sorry. Do you have any bruises or trauma to your back that I should be aware of?
No.
Okay. I'm noting where the scapula is and where the spine is. I'm also noting where the ribs are. Does any of this cause pain?
No.
Okay, everything appears to be normal upon palpation. Next, I'm going to do tactile fremitus. So I'm going to place the inner side of my hand in between the scapula and the spine, and also in between the ribs. And I want you to say 99 for me.
99.
And again.
99.
And one more time.
99.
Actually, I lied. Okay, and one more time.
99.
Okay. Vibration is normal and equal bilaterally. Next, I'm going to percuss. Again, I'm going to go in between the scapula and the spine and in between the ribs. And I'm going to percuss on the distal part of my finger. And again. I hear the normal tympanic sound, which is unexpected finding for that. Next, I'm going to go ahead and auscultate. So I want you to take deep breaths through your mouth when I tell you to, please. Okay, deep breath. Deep breath. And again. And again. Okay, now I'm down below the scapula. And again. 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 And then I'm going to ask you to raise your arm. I'm going to go about right under the armpit. And deep breath. Breath sounds are equal and clear bilaterally. Okay, you can go ahead and turn back to the front for me. Okay, so now I'm going to inspect the anterior of his chest. I don't see any signs of trauma, and the position of the thorax appears to be normal and symmetric. Next, I'm going to palpate. Do you have any bruises or trauma to your chest I should be aware of?
No.
Okay, I'm feeling for the clavicle. and also for the ribs. And I'm listening for any crepitus, which I don't hear or feel. Okay, next I'm going to do tactile fremitus. So again, I'm going to go under the collarbone and in between the ribs. I'd say 99.
99.
And again.
99.
And again.
99.
And again.
99.
Okay. Vibrations are equal and present bilaterally. Next, I'm going to go ahead and auscultate. Just go ahead and just take deep breaths like you did last time. Okay? Okay, do it again. Okay, you don't need to be that. Okay, again. 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 Take a deep breath. Okay. Then we're going to go under the tissue. Again. And one last time. Breath sounds are clear and equal bilaterally. And that is the end of my respiratory assessment.